Bismillahirrahmanirrahim. This presentation is related to hair follicle, and I will be discussing two conditions. One is a simple hair follicle injection, which is known as boil, and the other one is more complicated chronic hair follicle pathological conditions, which is known as Hidradenitis Suppurativa, and for sake of convenience we will label it as HS. Now, to understand boil and HS, you need to understand what is hair follicle, number one. So the hair, what is hair? Hair is an elongated keratinized structure, and it is derived from invagination of the epidermal epithelium and grows into the dermis as a hair follicle. Bulb is the terminal part of the hair follicle in the dermis, and it is a network of capillaries which nourishes the hair follicle. And muscle attached to the hair shaft is known as arrector pili, and there are several glands like sebaceous glands and sweat glands which are nearby which are which can be a part of the hair follicle. Now this is, I've taken an image courtesy of Cleveland Clinic to show you what are apocrine glands and what are the structure of the hair follicle. So to start with, this is epidermis. This from here to here is the epidermis, and from here to here is the dermis, and below is the subcutaneous tissue. So the hair is the invagination of the keratinized part of the dermis, epidermis, into the dermis, and this is the bulb of the hair follicle. That's the hair follicle, and this bulb has got a network of the capillaries which supplies the hair shaft. That's the sebaceous gland. This is sebaceous gland which secretes oily substance via the sebaceous duct into the hair shaft to lubricate the hair, and that's the arrector pili muscle, attached subcutaneous muscle which is attached to the hair shaft. Now let's look at the sweat gland. This is one sweat gland. Sweat gland is simple tubular gland which is opening up on the surface of the skin. This sweat gland is known as apocrine gland because it is opening up into the shaft of the hair follicle. So this is a brief introduction of the hair follicle, dermis and epidermis. Now what happens in the boil? Boil is infection of the hair follicle, and we go to the more clinical picture. We go to the clinical picture of the hair boil, and let us see. Now this is a patient who has got a lot of hairs in the abdomen. That's the umbilicus, and on the left lateral wall of the abdomen you see inflammation, red in color, lots of cellulitis. It's painful, and in the center is the necrotic area. This is known as boil, or it's also known as fungal, and this is the infection of the hair follicle. Staphylococcus aureus is the commonest organism which enters the hair shaft and goes into the follicle and causes infection. It's a very benign condition, and usually it settles down very rapidly, doesn't require much of any surgical intervention. Now I come to the more sinister condition, which is known as the Hidradenitis Suppurativa, HS. Now this is a photograph of an axilla, and you see redness over here. Inflamed redness over here. There are lots of hairs, and there is some edema over here. This is stage 1 of HS, earlier stage of HS. You don't see any sinuses, any abscesses, just redness. And as it progresses, as the infection progresses, then this thing appears. See, this is again axilla, and as the infection has progresses, you see multiple abscesses. There has been previous abscesses too, and which has caused scarring. So you get multiple infection of the hair follicles, and they form abscesses, and sometimes you get tunnels between the two of them, and this goes on and off for a long time. You get scarring, and sometimes because of the scarring there may be difficulty in abducting the arm. So this is a chronic condition. It may last for a long time, and this is how does it happen, what are the etiological factors. We come to this in a minute. See, this is a stage where the abscesses are healing up, and you get a lot of scarring. This is a quite a stage, but off and on it becomes inflamed and causes problems with pus formation. Now, what is the etiological factor in HS? What is it? It is a chronic follicular occlusive disorder of apocrine gland. So this is a chronic obstruction of the hair follicle along with the sweat glands. We do not know the etiology of this, but mostly it is maybe related to genetic, it may be related to hormonal, may be related to smoking, and usually there is a friction and rubbing between the two surfaces, and usually armpits and groin. Armpit is the commonest site for HS. HS starts after puberty, before the age of 40 years. Female are more involved, and it is not contagious, is not related to hygiene. The cause can be variable from mild to moderate to severe inflammation, and it can persist for many years, and it may cause emotional problems, uh, sort of depression. Uh, what is the pathology of HS? There is follicular plucking and obstruction. Hair follicles, because they cannot secrete their secretion, so it becomes obstructed. Hair follicles and sweat glands, apocrine sweat glands, they become distended, they become rupture, and they form abscesses, pus formation. There is healing, recurrent painful lump, scarring, and tunneling. All these sequence because of repeated infection. So there is blockage of the hair follicle and blockage of the sweat gland, and there is rupture of the hair follicle, rupture of the sweat glands, and this leads to abscess formation, recurrent abscesses. Maybe the one of the etiological factor which is mentioned over here is overactive immune response with a lot of inflammatory proteins. So important thing is to diagnose it earlier on and to treat it earlier on. The treatment may consist of giving medication by way of antibiotics. Sometimes they may require surgical incision and drainage, and maybe even excision of the skin and skin grafting. So important thing is be aware of this pathology and tackle it with early diagnosis. I stop